41 Action News starts now.
Our team here at 41 Action News is committed to helping you get back to work, make ends meet, and manage the pressure. So we're bringing your questions to city leaders right now.
It's all part of our initiative, The Rebound Kansas City. Joining us now, Kansas City, Missouri Mayor Quinton Lucas and Dr. Rex Archer of the Kansas City, Missouri Health Department. Thank you for joining us.
Good to be with you.
You know, Mayor Lucas,
Yes,
you
good to be with you.
recently announced the 10-10-10 reopening plan. It means business occupancy will be at 10% or less, or 10 people or less, whichever is greater. Business owners must also record the names of customers who are in their establishment for more than 10 minutes. So our first question for this town hall tonight is, how is the city enforcing these rules? And will there be penalties if businesses do not comply?
Well, first of all, I want to say thank you for letting us have the opportunity to explain what we're trying to do. And I know there are different rules throughout a number of jurisdictions. Everybody is trying to keep people safe, and that's our primary idea. In connection with how we would enforce these rules in Kansas City, we recognize a lot of it's going to be voluntary compliance. And I've talked to folks who have salons or folks who have any number of businesses in Kansas City who already are doing things like purchasing masks and gloves, making sure that spaces are going to be separated enough. And so that's how we'll initially do it. Our next step will be, as we always have had, the 311 system. You can call 311 if you feel that something's not being followed, either at your workplace or a place that you like to go to a lot. We would follow up by trying to talk to that business, trying to make sure that they correct and address those issues, and then only after that escalating that to some further follow-up, including potential fines. But our whole goal is not to be Big Brother. It's not to be a police state. It's to keep people safe. That's why we've promulgated these rules. And the other thing that's important to note now is that we hope that as we see stabilization in cases, that we're able to increase those occupancy levels to 25%, 50% over time. But we will always let data be our guide to make sure that we don't see a mass infection rate after things start to open up.
You know, Mr. Mayor, you said it. You mentioned being Big Brother. A lot of our viewers have had this question for us. They want to know about the process of collecting contact information. So who will be privy to that information?
Yep. So not me, not the Kansas City Police Department, no one but the Department of Public Health in the event there's an outbreak. You know, I'd like to describe it a bit like this. You know, if you call some restaurants, you make reservations. If you go to get your hair done, something that I never do, but you have to make sure you get an appointment set, right? It's that sort of thing. And those will be records that are left by the businesses themselves. The only situation in which Dr. Archer and our Department of Public Health have to reach out is if there is some sort of outbreak. This will help us, in fact, let people know that if there has been an outbreak, they've been exposed, that they should go get tested. And this is really how you can trace these things and stop outbreaks going forward. We all recognize we're going to have to live with COVID-19. This is one step that allows us to reopen, but allows us to make sure in the event of outbreak that we have some way to trace, that we have some way to get more people health care more quickly.
On that same note, how does collecting that information, Mr. Mayor, help Kansas City if larger grocery and department stores are not held to that same standard?
So, you know, one thing that is a bit confused about the standard is really, so first of all, it's only if you're sitting somewhere and only if you're sitting somewhere for a longer amount of time. For example, a restaurant, or if you are at the beauty parlor, right? This is not the sort of thing where we're having you do that if you're at a grocery store. Usually you're moving more, you're less likely to touch a number of surfaces right next to you. I mean, just look at me in this desk right now. I've touched the table, the notepad, my pen, the mug. That's the sort of thing that happens if you are somewhere for, usually seated for more than 10 minutes or for an extended amount of time. That's why we're doing that sort of step. We understand that there are risks at grocery stores. That's why we encourage everyone to wear masks. That's why we're encouraging everyone to maintain good social distancing and frankly not touch anything that you're not buying. But we also recognize that there's less likelihood that you usually go to the grocery store and sit in one spot for 45 minutes. It's a lot more likely if you go to a restaurant, you are sitting in one spot for 45 minutes. That's the only reason you'll see those types of different standards.
We're going to bring Dr. Archer into this conversation. Is the health department working with businesses on protocol when they do reopen, specifically businesses that can't social distance, like those barber shops and hair and nail salons?
Yes, we will be helping those businesses in opening. The important thing, as mentioned, and we've done this with pools for years, where the pool operators have to log their checking of the pool to make sure that it's being done. They don't send that in every day. They keep those, and when we drop by for inspection, we just make sure that they are maintaining and keeping those lists. We're not going to look at the details of that list, as mentioned by the mayor, unless we actually have a potential case and we need to be able to contact people. You know, some people may choose not to give their name. They could be hurting themselves if they do that, because if we have a positive case, we've had examples of restaurants where somebody who didn't know they even had the infection gave the infection to 9 other people in that restaurant because we didn't have the logs in some places. We've had even more community spread. So this just gives us the chance to then offer free testing to the public who have been exposed to contacts, so that they don't take it home, give it to their spouses, their family, put somebody in the hospital. So it's voluntary, but we strongly recommend it.
Will the health department step in if a business has a positive case?
Oh, absolutely. We do that with anything right now, from tuberculosis to measles to whatever. If there is a infectious disease at a business, we step in to help protect the other workers at that business. The business itself can be in real trouble if they have an outbreak and everybody goes down because of that disease that may be spreading through that organization. So yes, we will be out there to help those businesses. We've handled nursing home outbreaks. We've got other types of concerns in the metro area. There have been outbreaks among choir members, et cetera. So yes, public health gets out there to slow this down. The best way we can keep businesses and more businesses open, and we can reduce these restrictions, is if we have the capacity to test and follow up and put the outbreak fires down so that our community can be safe.
We still have much more to come. Coming ahead, we want to tackle your concerns about going back to work. That's right here after the break.
Mom always says to get your list. Mom always says to eat your veggies. It's okay to cry. A hug.
Need a hug.
Because Mama always says it's going to be okay. Make sure you have fun. Have fun. Dance. Smile. We see you, KSHB.
In this town, comebacks are in our DNA. When we're down, we always find a way to rise. But this time, the opponent will require all of us working together to overcome. And 41 Action News is right here, committed to help with the Rebound Kansas City. It's everything you need to get back on track, from money, your job, to caring for your family. Plus, easy ways to lend a hand. It's all in one convenient place. Who knows how long this rebound will take or what life will look like on the other side? But we will come out on top. We've done it before, and we'll do it again. The Rebound Kansas City, only on 41 Action News, KSHB.com, and on your favorite streaming device.
Feeling bottled up, can't get outside, and need a place to get away?
Time to get my discus on.
Didn't see that coming.
Hang out with 38 The Spot.
This is going to be huge.
Can you dig it?
Take a break.
Oh, yeah.
Enjoy life. And have a laugh on us.
What a great idea.
Sometimes you just need a little fun with your buds.
That's right.
You know it.
Friends, family, and 38 The Spot.
Good times.
You can't always trust the weather in Kansas City.
But you can always depend on the 41 Action News weather team to help you plan your day.
With forecasts that are scientifically proven most accurate by Weather 8.
Sunrise to sunset, season to season, 24/7.
The 41 Action News weather team.
Welcome back. As 41 Action News works to help Kansas City rebound from the coronavirus, we're taking your questions to Kansas City Mayor Quinton Lucas and the Director of the Kansas City Health Department, Dr. Rex Archer.
And our conversation continues now with your concerns about getting back to work. Mayor Lucas, many business owners are concerned about accessing personal protection equipment for themselves and their customers. How is the city assisting them? Is the city assisting them?
So there are a few different steps that we've taken. Just today, my office was proud to announce a new website, kcppe.com, that helps link those businesses that are trying to get enough protective equipment with local producers. There are a lot of businesses in Kansas City that have had to change what they do. They're making hand sanitizer now, they're making more masks, and so that is a wonderful resource where they can do that. For a number of our nonprofits, including homeless shelters and others, we've been working for some time with the Kansas City, Missouri Health Department, a number of other local organizations to make sure that there's PPE for all of our vulnerable populations. And then, of course, on the political level, we continue to try to make sure that hospitals, nurses, so many others have access to adequate PPE. I was on the phone today with Governor Parson of Missouri to talk about that very issue. So kcppe.com, if you're a business owner who's both looking to acquire more information, or if you're a business owner who's looking to sell more there, that's a good resource for us. And then certainly working with the city for a lot of our nonprofits and first responders.
Mayor Lucas, you recently tweeted the city has added protections mandating that an employer at a newly opening non-essential business can't terminate people who choose to stay home for health and safety reasons. How long will those protections last?
You know, right now those protections will last through May 15th. We understood that with our soft opening date of May 6th, there would be a number of people who had thought that they would not be going back to work at least until the middle of the month. We want to make sure those folks, no matter the reason, if it's health related, if they live with someone who has a compromised immune system or anything of that sort, is not rushing back. And I have to say this clearly. We think it is vital that if you feel sick or if you feel like there's some threat to you or your family, you should not be going to work. Indeed, that's how this virus is spread. I know we've all seen stories about meat processing plants throughout the Midwest where we've seen quick, contagious spread. And so we're trying to make sure in Kansas City we give that protection. We will certainly, after the 15th, look to evaluate that even further. But we think this is a vital safeguard, because I'll say this, reopening is important. We've heard loud and clear, and we know it is, but you have to reopen responsibly. Part of reopening responsibly means that we're protecting the men and women who are going to work every day here in Kansas City, and we're protecting their families. And I'm proud that our local government has done that important step, and I hope more follow.
You know, many of you at home have shared health concerns with us as the city reopens. We will get Dr. Archer's response.
Plus, addressing the future of Kansas City's economy. We'll tackle that when we return.
Mom always says to get your list. Mom always says to eat your veggies. It's okay to cry. A hug.
Need a hug.
Because Mama always says it's going to be okay. Make sure you have fun. Have fun. Dance. Smile. We see you, KSHB.
In this town, comebacks are in our DNA. When we're down, we always find a way to rise. But this time, the opponent will require all of us working together to overcome. And 41 Action News is right here, committed to help with the Rebound Kansas City. It's everything you need to get back on track, from money, your job, to caring for your family. Plus, easy ways to lend a hand. It's all in one convenient place. Who knows how long this rebound will take or what life will look like on the other side? But we will come out on top. We've done it before, and we'll do it again. The Rebound Kansas City, only on 41 Action News, KSHB.com, and on your favorite streaming device.
You can't always trust the weather in Kansas City.
But you can always depend on the 41 Action News weather team to help you plan your day.
With forecasts that are scientifically proven most accurate by Weather 8.
Sunrise to sunset, season to season, 24/7.
The 41 Action News weather team, KC's.
We're back with Mayor Quinton Lucas and Dr. Rex Archer with your questions as Kansas City works to rebound from the impacts of the coronavirus.
And we want to talk about health concerns now, Dr. Archer. Dr. Archer, what are the steps the city and the health department are taking to prepare for a potential second wave of coronavirus coming this fall, and how should the general public prepare?
Well, this is a really important question because all the national local experts expect this second wave. The better we do at complying with these and open up just enough and see how that works and take the next step, the less likely that second wave will be as great. We have learned from the 2003 SARS outbreak in Toronto that even after you have no cases that have been identified, you can still have a second wave. And we're obviously opening up when we still know that we've got cases out there. The other part of this is the public needs to know that there are ways that we can jump in and try to protect them and put an outbreak out. A lot of people are afraid to actually go out, and they should be concerned. So we're preparing by increasing our ability to test. Unfortunately, the nation wasn't prepared. We should have been preparing even back in December. We're now preparing, and we've had meetings. I was on the phone today with the governor, with the state health director, talking with the other local health departments on how we're gearing up to be able to do more testing. We also are in the process of adding a number of what we call contact tracers, or you could call them disease detectives. Their responsibility is when you have a positive case, it didn't come out of nowhere. They had to have been exposed to somebody, and they've probably exposed other people. So the sooner we figure that out, the less other people become infectious because of that case. The biggest challenge with this disease is a large percentage, in some cases 40, 50% of the spread is occurring in people that don't know they even had the virus. And that's what really concerns us, because if you, in fact, I'm asking everybody, and that's part of why we're asking people to wear masks, is assume that you may already have this virus and that you could be spreading it to others. That'll slow things down so that we can open up more safely.
Mayor Lucas, we've seen some of the response churches have had to leadership in the state of Kansas. Can you talk about what your recommendations for churches here in Kansas City, Missouri are as the city starts to reopen?
So we continue to work with churches. I've engaged the religious community throughout this process, and I want to thank them. Churches in Kansas City, Missouri, some throughout our region I've talked to, who have really adjusted to alternative forms of services, etc. They will be subject to the same rules in a fair way that others are, and so we continue to have that 10-person limit inside for the time being. We'll look to increase that, or the 10% capacity. There are meetings allowed of 50 persons outside at this point. I know for Mother's Day weekend, which is next week, as a reminder for everybody, there are some who are looking to explore what that may be. We will continue to engage with them, but this is important. And I talked to my own minister, Ron Lindsay, the other day. We're Baptists, and he said, I don't want to rush anybody back before they should. And I've been proud not just of that church community, but so many others that are saying we want to make sure we're not putting people at risk. I understand that there were the constitutional issues that were recently litigated and discussed in Kansas, but it's our view that we'll have an opportunity to work proactively with our churches to make sure they're opening, but opening safely. And I know Dr. Archer and the health department will work with them on that as well.
You know, Mayor Lucas, we know reports of domestic violence have really increased since the stay-at-home order went into effect. So how is the city addressing domestic violence and those impacted right now?
So we recognize that there are a lot of things in society that have always been challenges, but that become more accentuated during this time, and that has included a spike in domestic violence cases here in Kansas City, Missouri. This week, I'm proud that my colleagues on the Kansas City Council and myself were able to support an initiative directing the city manager to work not just with the Kansas City Police Department, but with our health department and with lots of agencies to make sure that we're creating more opportunities for alternative housing for those who are in situations where they may be in trouble, and to create more situations situations where we can actually find more funding to support our domestic violence shelters. It is imperative at this time, not just in domestic violence, but also child abuse. A lot of the crimes of the home that we have seen, we need to make sure people have that added protection. My office has also been reaching out to Airbnb, which I know has worked with the city of Chicago, to find hotel rooms for folks that feel like they need to flee dangerous situations. Those are the sorts of steps we're going to take, not just now, but throughout this crisis, to make sure that people are safe. And frankly, it's something that we need to have even after this crisis is over.
All right, gentlemen, thanks again for your time. Many of you have sent us questions about Kansas City's economy and the road to recovery, a very important topic, no doubt, and that's coming up right after the break.
We will always base our decisions on public health advice, public health recommendations, and frankly, doing the research that's necessary before we choose to act.
Because of the coronavirus, everything here is now in the dark.
We're losing millions of dollars in ticket revenue.
Cash flow has been sad.
Was there an effort to fix this before all this started?
Experts believe the recovery process will be a slow one.
It's unlikely things will go back to normal right away.
What do you say, Governor, to those thousands of people in the state who are still waiting to get those payments?
One of the biggest questions about those moving forward is what schools might look like when they reopen in the fall.
Schools will have to probably make some adjustments.
There's going to have to just be less kids in one area.
We can't share it with anybody, so I'm just dying to share this with everybody that we always have here.
I think it's going to be a while before it's come back to the normal.
We're trying to do a better job of that every day and trying to get the resources we need to do it.
We did extend the stay-home order to May 3rd because it's the right thing to do.
Employees here at Los Cabos Mexican Grill and Independence are pulling out all the stops to make sure their customers know they're safe.
If this table were sat, you wouldn't be able to see the adjacent table on the other side.
Our trackers can actually track down everyone, that we can know where an outbreak is, we can address it quickly.
We're making plans to remove some of the tables that we have.
Appreciate you, man. Thanks for coming out today. Totally a new concept.
Chance for us to really show our support for a large audience of people that are kind of going through a difficult time right now.
We're a family at the KCK Fire Department.
We are having to rely on each other even more.
All those special end-of-year events canceled. And when she went outside, she found this.
Hello.
A driveway prom.
We were fearful that we were going to have to close our doors permanently.
It's mom and pop stores like these that are hoping for any kind of assistance.
The Rebound Kansas City, it gives hope to small businesses. It gives us a voice.
A perfect opportunity to right now reflect on, what do you like to do? What are your interests? What do you do well?
It's an opening for you, disruption, for you to disrupt yourself.
I just want to thank all of you from the bottom of my heart.
We're back with more of your questions on how Kansas City will rebound from the impact of the coronavirus.
And in these final minutes, we want to talk with Mayor Lucas about the economy. One of our viewers asks, what is your specific plan for Kansas City's economic recovery and growth without raising taxes or relying on a federal bailout?
Well, there are a few different things that we need to make sure we're doing in Kansas City. First of all, supporting the economic sectors that are already still producing, have been for a while. That includes the construction industry. Kansas City, Missouri, while making sure that our construction industry is maintaining social distance, is also continuing to improve more projects, infrastructure, office development, etc., to make sure that we will have that industry going long term. That's one specific. Another thing we'll do is, I think, trying to find even more funds to support our small business emergency relief fund in Kansas City. This week we were able to get that on file. You can apply with the Economic Development Corporation of Kansas City. We have up to $500,000 of loans. We'll look to find even more resources for that to support those small businesses that have been impacted. And more to the point, I think we need to continue to re-engage with every industry sector. I talked to the Kansas City Restaurant Association this morning. I'll be visiting with folks in hospitality, folks in education soon. We know that we all need to work together to make sure that our businesses can come back. But, Dr. Archer noted something important before, which is that all of these measures, which largely are voluntary, this is the way we get back to business. This is the way that people feel more comfortable again, going out to eat, going out to buy clothes, going out to do any of the work that's necessary for our economy. So if we take these steps now, and I know they're tough ones, but if we take them now, then we can see us being even stronger over the fall months next year and beyond.
Well, gentlemen, we certainly appreciate your time. It's very insightful for all of Kansas City. We want to end this with final thoughts tonight for Kansas City, and we'll give you both about 45 seconds. We begin with Dr. Archer.
So the governor of New Jersey says public health creates economic health. A corollary is underinvesting in public health creates economic depressions. We need to learn from this that Missouri is 50th in public health funding, that is stressing us in the ability to open back up and open back up safely. So we're working very hard to find some creative ways to fix that. We've got a lot of volunteers that have been helping, but that's a critical piece. And unless people feel safe, the economy can't rebound.
And Mayor Lucas, final thoughts for you.
You know, I'll just quickly say this. Thank you so much. As somebody who was planning to go to the Big 12 tournament, 6-7 weeks ago, and saw our world change, all of us changed a lot of our springtime traditions. We've stayed home, we've stayed safe. There's a reason that when you look at the Kansas City Metro, our infection rate is not what you see in places like New Orleans and Detroit. It's because all of you in Missouri and Kansas have listened to public health advice, you've listened to the data, and we've all seen that we need to take these steps to make our community safer. Our world's going to change a little bit more now as we reopen. But don't forget why we took all those important steps. It's to keep our friends, our neighbors, our relatives, our families safe. So thank you for doing that. We're going to reopen responsibly, but we're also going to make sure that we do all we can to take care of Kansas Cityans. God bless you.
Dr. Rex Archer with the Kansas City Health Department, and to Kansas City Mayor Quinton Lucas, a sincere thank you so much for your time tonight and your insight.
Indeed, we appreciate it. And to everyone, including those of you who submitted questions, those of you who had questions, have a good night. We'll see you back here again tonight for 41 Action News at 10.